Hello students, as we have started studying Organon, in the last lecture we saw the first aphorism, that is mission. What is the mission of the physician? Okay, so moving ahead to the second aphorism, today we are going to learn the second aphorism. I will just first read the aphorism and then we will discuss it. Okay. So, the highest ideal of cure is rapid, gentle, and permanent restoration of the health or removal and annihilation of the disease in its whole extent in the shortest, most reliable, and most harmless way on easily comprehensible principles. So, let us understand one by one what are the points that Dr. Hahnemann has described to attain the ideal cure. Okay, so aphorism number 2, ideal cure. Okay, so what are the components of this aphorism and how we are uh, going to explain or how we are going to apply this into our practice? Okay, so the first thing what Dr. Hahnemann has mentioned about the cure is rapid. Okay, so the cure should be rapid. Okay, what do you mean by rapid? Rapid means fast. Okay, so as we are in the generation that is fast. Okay, everything is fast food. Hmm? So but Hahnemann has wrote this before 200 years, rapid. So what in the context of cure or in curing the sick? Okay, in the first aphorism only we have seen what is sick, what Dr. Hahnemann means about the sick. Okay, so we are going to restore the health. That means we are going to um, bring back that state of well-being that we have seen in the first aphorism. So in the process of restoring the healthy state of that uh, person who is sick, so the process should be rapid, that is it should be fast enough. Okay, so this is the first category. Then gentle. Gentle means it should not be harsh or rude. Okay, it should be gentle, mild. Okay, it should not harm the actual. See, because of the disease, because of the symptoms, the patient is already in pain. So when we are in pain, anybody for that matter, if anybody is in pain, what we need, what we supposed to do, we supposed to push or supposed to have the gentle touch to that person. May it be a physical pain or may it be a uh, emotional pain. Okay, so the medicine whatever we are going to cure or whatever the mode of the treatment, it should be gentle, as we have our medicines that will be coming in the coming aphorisms. Okay, so the next uh, part is, or the next category is permanent. So what do you mean by permanent? Permanent is like, see, we cannot say that if we are going to treat a patient and the patient is permanently, he will it will be uh, permanently cured of the condition, may it be acute, may it be chronic. Okay, see, what happens if uh, I will give you an example. There is no permanent cure, as say, but here what Hahnemann has to say that there are tendencies in our body. So by permanent, he means that the tendency should we should remove that tendencies. Okay, so that will also be coming in the aphorisms. Okay, yeah, maybe in the second year, third year. Okay, then that time you will understand about this permanent cure. But for time being, what we can understand, see, if a patient has is having flu, yeah, little bit acute inflammations and all that thing, so it is not like that we are giving medicines and the patient will be absolutely free from all the these acute ailments. They are going to occur in the lifetime of the patient. Okay, see, like if we bring some machine, or like for example, say you uh, bought some home appliance, kitchen appliance. Okay, what happens, it is okay, good, and we are handling it, huh? Then there is something, or something happens because of the external factor, or because of any internal damage, motor and all that things. Okay, something happens, we go to the mechanic, we got repair the machine, and we get back to our house. Okay, but uh, what happens in coming days, something happens, something or the other happens, and the machine gets again problem, giving some problem. Okay, so it is not the fault of the mechanic that he has repaired the our mixer. Okay, so likewise, there are some acute ailments, they are going to come into uh, patient's life. Okay, so it is a conditional thing, permanent cure. Okay, then, but what we are going trying to do here is permanent restoration of health, so that the patient, the person should be able to fight the diseases whatever he might get into his lifetime. Okay, then the next thing is removal and annihilation. Removal and annihilation of the removal and annihilation of the disease. Okay, in its whole extent. Okay, so what, uh, as we know, in homeopathy we practice on individualization. That means we do not treat the diseases, but we treat the person. Then why this word has come here about disease? Okay, because as I said earlier, in the first aphorism only we have seen that it is the restoration of the health in the sick. Okay, that means we are removing, as we know the definition of health given by who, that it is a complete well-being state of the person, complete well-being emotionally, physically, mentally. Okay, so we are, what we are doing here by cure, what we mean that restoring the state, that we are going to remove the disease symptoms from the patient, and we are restoring the patient to the previous state of well-being. Okay, that is the healthy state. Okay, so that is why this has been mentioned in the aphorism. Okay, then again, whole extent, what next is there, in the shortest, most reliable and most harmless way. Okay, again, shortest is rapid. Okay, because see, these two words are connected. Rapid is faster, and shortest means a short way in which we are going to reach to our uh, destination. Okay, so the cure should be in the shortest, then again in the harmless way, and on the reliable, the way, the process should be reliable. We should be able to rely on that uh, path of treatment. Okay, and the last but not the least is on easily comprehensible principles. Okay, so this is a actually a tricky thing here. Easily comprehensible principles. Easily comprehensible principle. What does this means? See, if we are studying, as Hahnemann said, homeopathy is art as well as science. So there are some basic principles to follow in homeopathy also. Okay, but if these principles, these basic theories, basic philosophy, if we are not able to understand, then how can we apply those things in practice? Okay, so that is why Dr. Henneman says that it should be based on easily comprehensible principles. That means the principles, the theories, the philosophy that should be easily understandable by the physician also and by the layman also, so that we can help or we can practice those principles. Okay, so this is meant by easily comprehensible principles. Okay, so this is all about ideal cure. Okay, so I think we are done with second aphorism, and in the next lecture we will be discussing the third aphorism. Okay, till then, happy learning.